Benzodiazepines represent a class of psychoactive drugs that have impact in society since their introductions in the mid-20th century. The history began with the discovery of chlordiazepoxide by Leo Sterbach in the late 1950s, introduced in the market in 1960s and quickly gained popularity in the United States and Europe. After, in 1970s, diazepam was introduced and became one of the most prescribed drugs worldwide. This medication has the ability to enhance the effect of GABA. They have been thought to increase sleep in anxious individuals. However, one big concern is how people can become dependent of them. In recent years, specialists are being more careful with their prescriptions. For example, in the European Insomnia Guidelines, benzodiazepines used for insomnia is not advised to continue for a period of 4 weeks or more. This drug is primarily known for the anxiolytic properties. However, it is also used as a calming effect that alleviates feelings of anxiety and stress. Alongside, they also possess sedative and hypnotic properties, aiding in the management of insomnia by facilitating faster sleep and improving the sleep quality. Moreover, these drugs exhibit muscle relaxant effect. The effect also varies depending on what type the patient has intake, short or long half-life, which differ in the duration of their action in the body. These drugs have both advantages and disadvantages. They have been useful in treatment for anxiety or acute sleep problems. The side effects, however, may include memory problems, slow down your breathing, especially when taken in sustainable amounts or mixed with alcohol or other drugs. Quitting the use of benzodiazepines rapidly can cause withdrawal symptoms. For this, the patient should be consulted after a brief time of usage to see if they have a favorable effect.
Regarding benzodiazepine withdrawal syndrome, it occurs when a long-time use of them is interrupted abruptly. Symptoms can be really variable since it includes from sleep alterations and panic attacks to even psychotic reactions. It has also been shown that these appear earlier and more intensely with short-term benzodiazepines. However, even normal doses could lead to anxiety and insomnia episodes for several days, including the possibility of having a complete withdrawal syndrome as well. Treatment has shown effectiveness with carbamazepine, for which gradual removal of the medication is a must. When talking about their mechanism of action, GABA enters into the brain and interferes with nerve impulse transmission mechanism. Benzodiazepines bind to the specific reception place in neurons present in GABA, the main inhibitor of the central nervous system. This process boosts GABA's effects, causing tolerance and making neurons overburdened, which respond less to excitatory neurotransmitters, cannot release other ones, and alter other essential biological processes.
And now about the relationship between benzodiazepines and suicidal behavior. The connection between benzodiazepines and suicidal behavior has not been clearly defined before, but in a recent case crossover study that was carried out nationwide in France examined this relationship, and they found that exposure to benzodiazepines was strongly associated with suicide attempts or committing suicide, meaning that within a 30 days of dispensing benzodiazepines, there was a great risk of the patient committing or attempting suicide. The risk was especially strong with benzodiazepines with short half-life than with the longer half-life benzodiazepines. Since this research indicates that suicidal behavior is strongly connected to the usage of benzodiazepines, suicidal behavior screening should be done before prescribing benzodiazepines to patient, and if prescription is done, regular checkups should be done with the patient in order to ensure that the treatment is working and when to stop using them. Other treatment options should be also evaluated since benzodiazepines are a short-term solution, and the other treatment options can be more beneficial